Hello and welcome to Our Skincare. I am Awa, and today I will be sharing with you the benefit of 100% raw African shea butter. And also I am very honored to have today one physician and researcher, Dr. Perez, all the way here from Miami, Florida. Welcome, Dr. Perez.
Welcome. Well, I must tell you, always a pleasure talking to you because we share the same worries and the same feel to improve the quality of life of people.
I know.
Since I have made my research and know that you are giving me a huge opportunity to educate the people and make them aware that we got right here in South Florida a product that will improve a lot of hair and skin conditions.
Well, thank you so much.
Full of benefits. Full of benefits because it do not interact with any kind of medication or condition that they could have. And it's never out of being active, had no expiration date.
Yes.
And it's very well that people know that are very affordable and very easy to use. They got something that will protect and prevent and cure a lot of things in their skin and hair.
Now tell me, for how long you've been now researching about raw shea butter?
Well, to tell you the truth, research is in a relative short time.
Yes.
But I have knowledge of this kind of product since I was reading history and start looking at explorers and physicians that used to work in Western Africa, like Livingstone and Dr. Swasser, etc. Later on, people that belongs to the medical corps of the Cuban Army that were in places that Namibia, South Africa, Angola, and some other places, the Western coast, taught me about a product that has a social connotation because it was harvested by the females of the population, and
that
the eldest one was the one that started separating the pulp of that tree, and the youngest one used a sliding stone, tried to smash them. And that
that was raw African shea butter.
That product could be used for multiple things, and even though they were with their exclusively Western kind of practice in medicine, sometimes that they got charged of supplies. They report to me in conversations that they was forced to use that product to cure some wounds, infections,
lesions on your skin.
Ulcers and skin, produced for boots, etc. And it was a great success. So that put me aware that something good existed that could not be found easily in the Western world.
And you've been using it now for your clients.
Well, there was a day.
Your patients, I would say.
You know something, there was a day that I consider very fortunate, not only for me, but for the patient that I take care of, and the result of my investigation when I met you was this product. And at the beginning I said, my God, I think that this is it. The thing that I was reading by history, the things that the people were reporting me that they witnesses and use it in Africa, and I think that this is it. At this moment, I start making a research. And I researched that, and I got very aware of the contents. And the uses. How it could be used in different parts of the world. The more wide use that got in Africa, and unfortunately, the most restricted use in the Western world. And I did some tests with the product.
And you did some tests with this product, which is AwaSkinCare. I know that. And what made you choose AwaSkinCare?
Well, I made use this because the way of production of the filtering use a clay filtration that is closest to nature's and do not even use any allergen or something else to filter that. Besides that, the result of some test analysis told me that it got very important fat acids that have a very important function as anti-agents and antioxidants and protectant the skin. Like, for example, the composition that got that product according to labs show me that got some elements that cannot be saponificables. That means that they cannot be converted into soap.
Yes.
But at the same time has arachidonic acid, alanolaic acid, linoleic acid, stearic acid, etc. Some of them are essential acids for a human being.
Yes.
That are very important components in protect and cure skin.
Yes.
As soon as I saw that,
yes.
and I have on the characteristic that was described to me as the best grade of purity, that as you are very well aware, the same product has not the same kind of purity.
Well, I know that because I was born in West Africa and raised in West Africa. I myself been using raw shea butter forever until I left home, and of course, like anybody, I started to use anything that really smelled good, was expensive, and had a name on it. Until I get back to my roots one day and started it, but mostly it's by sharing my stories with people like you, doctors. They really validated what I knew already was working in this product. And that's why I am the one who's honored to meet you that day, because most of the things that I understood, that I experienced, you were able to put a name on it in a way that I could share it now with the whole world, you know, because there is the scientific word that people will go and research and know, oh, okay, I know what you're saying. So I am the one who is very honored to have you here today.
Well, it's the same to me. That is yours.
The other thing I would like to know is, how do you instruct your patient to use this product? Because we talked about it, and so many of us just use shea butter different ways. I know I have my way of using it, and most of the time when I do share that, I have people open their eyes wide open and say, I never knew that. And actually you were one of them, because you were like, oh my God, it makes sense. So tell me, share with me, how do you use the raw shea butter with your patients who are going through diets?
Well, after knowing that it was the purest form of this product, that you know, this ABCD, this is A, and I started using it myself, I could propose and teach people and make them aware of this product on a person-to-person basis. As soon as they were appearing to the investigation center that I I'm the principal director, and to my clinical practice, I tell them first, do not be afraid of this product.
Yes.
It could be, it sounds strange to your Western ears, but it's excellent.
I know.
This product has no expiration date, and it does not interact with nothing that you are taking. Okay. And I start using it for a very dry skin. And at the same time, I use it as a complement of anti-aging treatment because of the antioxidant properties that the content of this product tell me, thanks to the results of the lab science that it was made it undergo. Besides saying that to the people, I ask them to have 15 minutes of their day for something that is not invasive and is painful. They could use the product by applying this on a circular movement.
Friction.
The friction is very important because it's a way that you get in contact with your skin. There is a theory that is very serious and has excellent results that says that you must be in contact with yourself
skin,
every day.
Absolutely, because we all know by now that your skin is your largest organ, and you breathe through your skin more than you breathe through your lungs. I mean, we think it's closed, it's all open. Anything you put on it goes to your bloodstream. So, and the day we met, actually, I was sharing with Dr. Perez, and I said, well, doctor, the thing is, most of the people, they use shea butter after they shower. And he's like, yes. And I said, but you know what? Forever, my ancestors used it before they shower. And I remember you just pausing, and it was just like you got something yourself, and you say, you are right. Now I get it. It's the friction of the shea butter on your skin that build that collagen, and that you're gonna do once you shower and ready to go.
That's
right?
That's right. You put the light on me and said that is the thing, and that is the way that interacts with the patient.
Yes.
First, you enter in contact with your whole skin.
That's right.
Because it's useful for something that cellulitis,
Yes.
wounds, wars,
Yes.
dryness, etc.
That's right.
And after waiting optimal time, 15 minutes.
Yes, 15 minutes, not 50, 15.
15.
It's
15.
15.
A quarter of an hour.
I
You
know.
can go over your shower.
Yes.
And there is a product that is not the star of this film, but
Yes.
it's used.
It is. Yes, it's
That
not
is
the star, but we know it's here, and it's the black African soap, and we'll talk about that later.
It's the perfect sidekick to the
Yes.
to the butter.
Yes.
Because it's a very natural produce.
That's right.
Made of a saponiferous acid grass also.
That's
that
right.
Has skin protectants.
Yes.
And you use that.
Okay.
To bath yourself.
Yes.
After you finish bathing, the best things you must do is not be rough with your skin.
That's right.
Protect your skin. You should start drying.
Yes.
By
But
applying
drying.
some.
Yes.
And then you can expect the next day to do that.
That's right.
So it's something that you don't have to have a specific time of the day. Or a specific activity. Just by opening a little space in something that you nevertheless are going to do.
That's
by
right.
bathing,
That's
you
right.
get the best results.
That's right.
It's not producing any itching, and be patient.
And be
You
patient.
report to me when you start getting good results, but remember how many years you are on planet Earth. And I'm telling you that in the next month you are having the best skin available to you. I think a month to get results is not an eternity.
Well, doctor, I don't think I can say it any better than this anymore. Thank you so much. Let's hear what other people have to say about the use of raw African shea butter combined with the black soap, and of course, before you shower.